Is it that one, like you're looking at the armpit?
No, because
No?
that one is for the levator.
Okay.
Oh, actually, no. The one you're looking at armpit is for the upper traps.
So then there's another one where you're looking back, I think. And
Oh, wait, sorry. My mistake there. The one to the side is the upper traps. The one you're looking at the armpit is the levator.
okay.
When you're stretching the suboccipitals, you just
You're
get
going
them
down like
straight
that?
down. Yes. Mm-hmm.
Okay.
So we're like around 2:50 there.
Mm-hmm.
All right, so I would have them. All right, Michelle, can I have you sit up? Okay. Can you bring your chin to your chest?
Oh.
Bring your chin, tuck your chin to your chest. So to stretch the suboccipital, sometimes I like
It's
to
this
kind of
one,
pull
right?
this down and then kind of like push this in. Yeah, this I didn't show you guys last time. So we can do this.
And you hold it for like 20, 30 seconds?
Yep. I will hold it for 20 seconds or so. And the easy part with this one is with the suboccipital, since you're doing left and right. With this one, even if you did the points separately, you can't stretch them separately. It's gonna be, you stretch them the
Both.
same. Yes. So that you can save some time there.
Right.
All right. And then if you're going, let's say you're going too fast and you have minutes, like seconds or minutes to kill, you can always use what we call the Petrissage or Effleurage. That's the traditional rub down.
Oh.
Like that's the traditional
When you're
like
just, like,
doing
going
that.
like-
Yes. Okay. So now that we work that, the next point is the levator, right?
Mm-hmm.
So you can actually, again, I'm doing both sides same time, because if you're doing it one, you can do this, or you can actually, if let's say you're this side and you feel like your hands are not strong enough,
Use both hands.
thumbs, you can do that. So you pick.
Okay.
Okay. And this is where everybody has their own technique. Carmel will do this differently.
Mm-hmm.
I would do this differently. Rohit will do this differently.
Right.
Depends on what's comfortable for you. And you can ask me, like you can tell me, okay, am I doing? Is this okay? Then I'll tell you based on medically, theoretically it should be fine. What's most important? You ask the patient.
Okay.
How are you feeling? You feel okay, Michelle?
Mm-hmm.
Okay. You feel okay? That's the most important part. How much pressure? Well, it
It's up to
depends.
them.
Yeah. I always tell the patient, let me know if I'm pressing too hard.
Okay.
I tell them that because I know I tend to press hard sometimes. And if they're frail, they're small, or they're big, they're gonna tell you, oh, you're not pressing deep enough.
Mm-hmm.
Then I probably wouldn't be doing this.
You'd
I'll do
probably
one
go
side
on.
at a time. Yeah, I'll use
Okay.
two hands. All right. So after that, so since this one we're doing two at the same time instead of one and one, we do
A minute and a half.
yes, a minute and a half for both also. All right. So after that, then you just wanna hold
So the hold will be the last 30 seconds?
and have it a minute also.
A minute?
I actually hold for more or less a minute or sometimes even longer.
Okay.
Because that feels good when you release it.
Oh, okay.
Yeah, especially if the muscle is very, very tight.
Mhm.
Sometimes I hold longer. Because then the thing is for us, I can feel if it's releasing. For you guys, it takes a lot of practice. So more or less a minute should be okay. If doing this as my hand's getting tired,
You'll
I
switch.
use my other. I actually
Oh.
just use two of them together. I
Oh.
relax this, I'm pressing with this.
When you're holding it, what is that doing?
There's when you have a pressure on the muscle, after a while, it actually relaxes. If you have a trigger point there,
Mhm.
what they call it's called ischemic compression. You're trying to compress the blood flow, so try to get it to relax.
Okay.
That's the kind of like the very foundation of the pressure point release. Okay, can you see this one? Okay. So we can continue holding it there. Okay, so now after we do the holding,
Mm-hmm.
we'll do a stretch for the levator. So this one, you gotta stretch each side
Okay.
because you can't do it at the same time.
Mhm.
Okay. Now